Welcome to our deep dive all about hypothyroidism.
Oh, this should be fun.
You sent us a ton of medical articles,
It's a lot. Yeah.
and it seems like you really want to understand not just the what, but the why.
Exactly.
And that's why we're here.
Love it.
Today, we're going way beyond just like that basic slow metabolism stuff.
Right.
We really want to explore how hypothyroidism can affect your whole body
The whole body, yeah.
in ways that you might not expect.
Yes, hypothyroidism is a bit of a chameleon.
Oh, I like that.
You know, it can show up with very common symptoms.
Right.
But it can also kind of manifest in these surprising ways
Mm.
and impact systems that you might not think are connected to your thyroid.
I love that analogy, a chameleon.
Yeah.
Okay, so you mentioned in your notes that you were really curious about some of the less obvious signs of hypothyroidism.
Yeah.
Let's start with something I think we all can relate to.
Okay.
Our skin.
Good choice.
Okay.
Dry skin and just roughness are pretty common with hypothyroidism.
Yeah, but did you know that it can also lead to hair loss, brittle nails,
Oh, wow.
and even make your skin look slightly yellowish?
Yellowish skin.
Yeah.
I have to admit that's not the first thing that comes to mind
Right.
when I think of thyroid issues.
Sure.
You mentioned this was related to carotenoemia.
Yeah.
What exactly is that?
Well, you know how carrots are good for your eyes
Yeah.
because they're packed with beta-carotene,
Mm-hmm.
and your body converts that into vitamin A.
Right.
But when your thyroid hormone is low, that conversion process gets sluggish,
Mm-hmm.
and the beta-carotene builds up in your skin,
Interesting.
giving it a yellowish tint.
Wow. So it's not just about the thyroid itself.
You know,
It's about how hypothyroidism affects the way your body processes essential nutrients.
that's right.
Wow. And what about swelling? I know that can be a symptom,
Yeah.
but the articles that you sent mentioned a specific type of swelling
Uh-huh.
called myxedema.
Exactly.
Yeah.
It's not just regular puffiness.
Myxedema is a non-pitting type of swelling.
Non-pitting.
Yeah. So that means if you press on it,
Right.
the indentation doesn't stay.
Oh.
And it's caused by an accumulation of these molecules called glycosaminoglycans.
Glycosaminoglycans.
Yeah.
Now, there's a word I haven't heard in a while.
It's a mouthful.
What are those exactly?
So think of them as long, stringy molecules that attract and hold on to water, kind of like tiny sponges.
Got it.
In hypothyroidism, these molecules build up in the skin and tissues, causing that firm, non-pitting swelling.
So those seemingly subtle changes in your skin,
Yeah.
dryness, brittle nails, that yellowish tint,
Yeah.
those could be the first clues that something's up with your thyroid.
They could be.
It's like your body's sending you a subtle signal.
Exactly.
And speaking of subtle signals, we also need to talk about the eyes.
Yes.
Right? Periorbital edema or swelling around the eyes. That's another thing you highlighted in these articles.
Yeah.
Is that common with hypothyroidism?
Yes, quite common. Okay.
And if you've ever had Graves' disease,
Right?
which is an overactive thyroid condition, some eye issues like bulging or that kind of staring appearance
Yeah.
might actually linger even after you become hypothyroid.
So it's not always just a simple case of one condition or the other.
No.
You could be dealing with the after effects of a previous thyroid issue,
Right.
which could make things even more confusing.
Exactly. It's like piecing together a puzzle, considering all those pieces of your thyroid history.
And speaking of piecing things together, let's shift our focus inward and look at what hypothyroidism does to your heart and your lungs. Okay, let's unpack that.
Sure.
You mentioned in your notes that you're particularly concerned
Yes.
about the cardiovascular effects of hypothyroidism.
And rightfully so.
Okay.
You can think of hypothyroidism as like throwing off your body's internal thermostat. Everything slows down,
Okay.
including your cardiovascular system.
So that's why fatigue is such a common symptom. Exactly.
Like your body's running on low power mode.
Yeah, like low battery.
Right.
But it goes beyond just feeling tired.
Okay.
Hypothyroidism can also lead to a slower heart rate, higher cholesterol, and even an increased risk of heart problems.
Yeah.
Especially if you already have pre-existing conditions.
Okay. That's definitely something to take seriously.
Yes.
And what about breathing? I know shortness of breath is mentioned in a lot of these articles.
Yeah.
How does that tie into hypothyroidism?
That's a great question. Shortness of breath is common.
Okay.
And it's not always just about your lungs.
Right.
It can be connected to the heart's reduced output. Remember, everything's slowing down.
Right.
It can also be linked to sleep apnea.
Oh, wow.
Which can be more common in people with hypothyroidism.
Sleep apnea.
Yeah.
Now, that's a connection I wouldn't have made.
Right.
It's fascinating how these seemingly unrelated things
Yeah.
can be so intertwined.
They are all connected.
Right.
Absolutely. And we're seeing a pattern here, right?
Yeah.
Hypothyroidism slows things down, whether it's your heart, your lungs,
Or your gut.
or your gut.
We've talked about how hypothyroidism affects the outer body.
Yes.
But what about what's going on inside?
Yeah.
Let's take a look at the gut.
Okay.
What kind of issues does hypothyroidism stir up there?
Well, if you're prone to constipation,
Yeah.
hypothyroidism can make it significantly worse.
Oh, Joel.
This is because the muscles in your digestive tract are also affected by that slower metabolism.
Anything else?
In some cases, there can be more serious issues, like bacterial overgrowth in the small intestine. But constipation is definitely the most common complaint.
Got it. So we've got the skin, the eyes, the heart, the lungs, the gut.
Yeah.
All systems affected by this tiny gland.
That's right.
But what about hormones? Does hypothyroidism mess with those too?
Absolutely. Hypothyroidism doesn't just affect your thyroid hormones.
Cool.
It can have this ripple effect on your entire endocrine system. Right. Think of it as a complex orchestra. You know, each hormone plays a specific role.
Right.
And when one instrument is out of tune, it can throw off the entire symphony.
So we're talking about the body's master control system here.
We are.
What kind of hormonal havoc are we talking about specifically?
So for women, hypothyroidism can cause irregular periods, decreased fertility, and even a condition called hyperprolactinemia.
Hyperprolactinemia.
Yeah.
That sounds intense.
It can be.
Can you break that down for us?
Sure. Prolactin is the hormone responsible for milk production.
Right.
But when levels get too high, it can interfere with that delicate balance of hormones that regulate your menstrual cycle. This can lead to irregular periods and make it harder to get pregnant.
Interesting. So ladies, pay attention to those menstrual cycles.
Yes.
They could be trying to tell you something important about your thyroid.
Ab-
And what about men? Does hypothyroidism throw a wrench in their hormonal works too?
It definitely can.
Okay.
We see decreased libido, erectile dysfunction, and even sperm morphology can be affected.
Whoa, sperm morphology.
Yeah.
I'm guessing that's referring to the shape and the structure of the sperm.
You got it.
Right.
And it's a good reminder that hypothyroidism can have these very specific and potentially serious consequences, even at the cellular level.
Wow.
Which could impact fertility for men.
Okay, we've covered a lot of ground skin, eyes, heart, lungs, gut hormones.
Yeah, we have.
But there's one big one left to the brain.
Oh, yeah.
And this is where I think things get really interesting.
Absolutely.
You mentioned in your notes that you're particularly interested in the neurological effects of hypothyroidism.
Yes, the brain is a fascinating and complex organ.
It is.
And hypothyroidism can affect it in a multitude of ways.
Okay.
From causing carpal tunnel syndrome and muscle weakness to contributing to more serious conditions like Hashimoto's encephalopathy.
Hashimoto's encephalopathy, that definitely sounds serious.
It can be.
So the brain itself can be directly affected by hypothyroidism.
That's right. It's thought to be an autoimmune condition where your immune system mistakenly attacks your brain. This can lead to a whole range of neurological symptoms, from confusion and memory problems to seizures and even psychosis.
Wow, that's scary stuff.
Yeah.
And then there's myxedema coma, which I know is a rare but very serious complication of hypothyroidism.
Yes. Myxedema coma is essentially the extreme end of severe untreated hypothyroidism. Okay. It's a life-threatening condition that requires immediate medical attention.
Of course.
The good news is that it's extremely rare.
That is good news.
Especially if hypothyroidism is diagnosed and managed properly.
Okay, so we've got carpal tunnel muscle weakness, Hashimoto's encephalopathy, myxedema coma. Are there any other brain-related symptoms?
There is one we haven't touched on yet that's closely related to brain function.
And that's cognitive changes.
Ah, yes. The infamous brain fog.
The brain fog.
Tell me more about that.
So hypothyroidism can cause all sorts of cognitive issues, from difficulty concentrating and remembering things to feeling mentally sluggish and slow. It's like your brain is running in low power mode.
Yeah.
Just like we talked about with the rest of your body.
I can definitely relate to that.
Yeah.
So we're seeing that hypothyroidism can affect the brain on so many levels.
It does.
From physical symptoms like carpal tunnel
Yeah.
to cognitive changes like brain fog to serious conditions like Hashimoto's encephalopathy.
That's right.
It's like this tiny gland has a huge impact on our entire nervous system.
It really does.
And it's a reminder that we can't just focus on the most obvious symptoms.
No.
We have to consider the whole picture.
Yes.
The subtle signs and the potential for serious complications if this is left untreated.
Absolutely.
Well said.
Yeah.
And speaking of complications, let's shift gears and talk about something we've touched on briefly. Okay.
But haven't fully explored yet the metabolic mayhem that hypothyroidism can create.
Right. Hypothyroidism impacts how your body processes basically everything.
Wow.
From nutrients to hormones to medications.
Yeah.
And that can lead to a whole cascade of metabolic imbalances.
Okay, let's unpack this metabolic mayhem. What are some of the key things that go haywire?
Well, for starters, there's hyponatremia.
Hyponatremia?
Yeah.
What is that?
Which is a low level of sodium in your blood.
Oh.
It can be caused by a number of things.
Right.
But hypothyroidism is definitely one potential culprit.
And why should we care about low sodium? What kind of problems can that cause?
Hyponatremia can be tricky because it can mask other conditions, making diagnosis more difficult.
Right.
It can also cause a range of symptoms from fatigue and headaches to, in severe cases, confusion and seizures.
Wow.
Depending on how low your sodium levels drop.
So not something to be taken lightly.
No.
And we've mentioned high cholesterol a few times already.
Yeah.
How does hypothyroidism play into that?
It's not just that it can cause high cholesterol.
Okay.
It's the specific types of cholesterol that are affected.
Right.
Hypothyroidism can lead to elevations in both total cholesterol and LDL cholesterol, which is often referred to as the bad cholesterol because it's linked to an increased risk of heart disease.
Right. So yet another way that hypothyroidism can impact your cardiovascular health.
Exactly.
Anything else on the metabolic mayhem front?
One more important thing to be aware of drug interactions.
That's a good point.
Yeah.
I bet most people don't even think about that.
It's crucial to be aware of this if you're taking any medications.
Right.
Hypothyroidism can affect how your body processes certain drugs.
Oh.
Which means you might need dosage adjustments to avoid potential toxicity.
Right.
Or reduced effectiveness of your medication.
Okay, that's a great reminder to always talk to your doctor about any medications that you're taking.
Absolutely.
Especially if you are being treated for hypothyroidism.
Yes.
It's about clear communication and working together to manage your health effectively.
I couldn't agree more. Communication is key when it comes to managing any health condition.
Right.
Especially one as complex as hypothyroidism.
Well said. We've covered so much ground in this deep dive already.
We have.
From skin changes and swelling to hormonal imbalances and brain fog to the metabolic mayhem that can ensue when this tiny gland goes awry.
It's truly remarkable how much impact the thyroid has on the entire body.
It is, and we've still got more to explore.
Yes, we do.
But for now, let's take a break and come back for part 2, where we'll delve even deeper into the world of hypothyroidism.
Sounds good. Welcome back.
I'm impressed with how much ground we covered in part 1.
Me too.
Hypothyroidism really is a master of disguise.
It is. It hides behind all these seemingly unrelated symptoms.
Right.
But thanks to your research and the articles you sent us, we're starting to see through those disguises.
Exactly. And now that we have a better understanding of the wide range of symptoms, let's dive into some specific cases that illustrate the complexity of hypothyroidism.
Absolutely. I love case studies.
Me too.
They bring the science to life.
They do.
So let's start with a case that demonstrates how hypothyroidism can present differently in different age groups. Imagine a young woman in her 20s who's feeling constantly tired. She's gaining weight and her periods are all over the place.
Yeah, it's easy to dismiss those symptoms as just life when you're young.
Oh, absolutely.
Right.
Stress, bad eating habits, burning the candle at both ends.
Right.
Exactly. But what if we dig a little deeper? Imagine she also mentions her skin feels drier than usual. Her hair is falling out more than normal. And her face seems a bit puffier.
Oh.
Those subtle clues, combined with the more obvious fatigue and weight gain, might point to hypothyroidism.
Ah, so it's about connecting the dots and looking beyond the most obvious symptoms.
Exactly.
A simple blood test could confirm the diagnosis.
Right.
And lead to treatment, which could make a world of difference for her.
Precisely. Now let's consider a middle-aged man who's feeling sluggish, his muscles ache, and he can't seem to focus at work.
Again, those are things that could easily be brushed off as just part of getting older.
Unfortunately, yes, but what if he also has high cholesterol and slightly elevated blood pressure?
Okay.
Those are two more pieces of the puzzle that, when combined with his other symptoms, could suggest hypothyroidism.
So again, it's about looking at the whole picture.
Exactly.
And recognizing those seemingly minor details that might be trying to tell us something important.
It might be a clue.
Right.
And in this scenario, a doctor who takes a thorough medical history, including questions about family history of thyroid disorders, might suspect hypothyroidism and order the right tests. Early diagnosis is key.
These are great examples of how hypothyroidism can be sneaky.
It is.
And how important it is to advocate for yourself and ask those questions.
Ask questions.
Now, what about how hypothyroidism interacts with other health conditions?
Let's consider a woman with a history of heart disease.
No.
Imagine she starts experiencing worsening fatigue and shortness of breath.
It'd be easy to assume those symptoms are due to her heart condition.
You would think so, right?
Right.
But they could also be a sign that she's developing hypothyroidism, which would put additional stress on her heart.
So in this case, it's crucial to consider hypothyroidism as a potential contributing factor to her worsening symptoms.
Right.
And because hypothyroidism can affect how the body processes medications, it's even more important to monitor her closely if she's taking heart medications.
Absolutely.
That's a great point. So we're seeing that hypothyroidism can have this ripple effect on other health conditions, making it even more important to recognize and manage it effectively.
Exactly. And these are just a few examples.
Right.
The way hypothyroidism manifests can be incredibly varied. It really depends on the individual. Their age, their gender, their genetics, their overall health, and even their personal and family history.
Right. There's no one-size-fits-all approach to diagnosing or treating this condition.
Exactly. It's all about personalized medicine, taking into account the individual's unique circumstances.
Right.
And that brings us to a topic I know is especially relevant to our listener today. The emotional and mental health aspects of hypothyroidism.
Yes. You mentioned in your notes that you were interested in exploring this further.
I am.
We've touched on brain fog, but I know depression and anxiety are also common in people with hypothyroidism.
Very common.
Can you talk a little bit more about that connection?
Of course. So the thyroid gland plays a critical role in regulating mood and energy levels.
Right.
When your thyroid hormone is low, it can disrupt that delicate balance of neurotransmitters in your brain.
Neurotransmitters. Those are the chemical messengers that allow our brain cells to communicate.
Yes, exactly. And when that communication gets disrupted, it can lead to feelings of sadness, hopelessness, anxiety, and irritability.
I can definitely see how that would make it hard to function.
It does.
Let alone thrive.
Exactly. And here's the really tough part. The fatigue and other physical symptoms of hypothyroidism can further contribute to those feelings of depression and anxiety, creating a vicious cycle. You feel exhausted and down. So you don't have the energy to do the things that might lift your mood. And that just makes you feel worse.
So what can someone do if they're stuck in that cycle and struggling with these emotional and mental health challenges?
Well, first and foremost, it's crucial to address the underlying hypothyroidism. Getting proper treatment to restore your thyroid hormone levels to a healthy range can make a significant difference in your mood and energy.
Right. So getting that hormonal balance back is key.
Yes.
But are there other things that people can do?
Yes, there are.
To support their mental and emotional well-being while they're working on getting their thyroid levels back on track?
Absolutely. Even small changes can make a big difference.
Okay, what kind of changes?
Regular exercise, even just a brisk walk a few times a week, can help boost your mood and energy levels. Focusing on a balanced diet with plenty of fresh fruits, vegetables, and lean protein can provide your body with the nutrients it needs to function optimally.
Those are great starting points.
Yeah.
It's amazing how much power we have to support our health through lifestyle choices.
It really is. And don't underestimate the power of stress management.
Stress management.
Things like yoga meditation, deep breathing exercises, or spending time in nature can help calm your nervous system and reduce anxiety.
All great tips. And of course, prioritizing good quality sleep is essential for overall well-being.
Absolutely.
Especially when you're dealing with hypothyroidism.
Exactly. Aim for 7-9 hours of sleep per night in a cool, dark room to help your body rest and repair itself.
It's about taking a holistic approach.
It is.
Addressing the physical,
Yeah.
the mental, and the emotional aspects of hypothyroidism.
Right.
And for some people, therapy or counseling might be helpful
It could be.
in addressing those emotional challenges and developing coping strategies.
I completely agree. There's no shame in seeking professional support.
Right.
Especially when you're dealing with a condition that can affect so many aspects of your life.
Yeah.
Sometimes just talking to someone who understands what you're going through can make a world of difference.
Well said. So we've explored the diverse symptoms of hypothyroidism,
Yeah.
the challenges of diagnosis, the impact on other health conditions, the connection to emotional and mental health.
That's a lot.
What else should our listener know about this complex condition as we head into the final part of our deep dive?
I think it's important to emphasize that even though we've covered some serious topics, hypothyroidism is treatable.
Yes, there is hope.
There is.
Tell us more about the treatment options.
The most common treatment for hypothyroidism is thyroid hormone replacement therapy. Oh. This usually involves taking a daily pill called levothyroxine, which is a synthetic version of the hormone thyroxine, or T4.
Okay, so it's basically giving the body the hormone it's missing.
That's right.
Sounds straightforward enough.
It is in principle.
Okay.
But finding the right dosage can take a bit of trial and error.
Right, so it's not a one-and-done situation.
No.
It's about finding that perfect balance.
It is.
And while medication is crucial,
yes,
what about those lifestyle changes we talked about earlier?
Yeah.
Do they play a role in managing hypothyroidism too?
Absolutely. While they're not a replacement for medication,
Okay.
lifestyle changes can be incredibly powerful tools for supporting overall health and well-being if you have hypothyroidism.
Okay, give us the rundown on the top lifestyle tips for managing hypothyroidism.
Here are a few key things to focus on. Diet. A balanced, nutrient-rich diet is essential for everyone.
Of course.
But it's especially important for people with hypothyroidism.
Right.
Focus on whole, unprocessed foods, including plenty of fruits, vegetables, lean protein, and healthy fats.
Got it.
And be mindful of goitrogens, which are substances that can interfere with thyroid function.
Oh.
These are found in some foods like cruciferous vegetables, broccoli, cauliflower, kale, soy products, and cassava.
While these foods can be part of a healthy diet,
They can.
it's a good idea to cook them thoroughly
Yes.
and consume them in moderation
Yes.
if you have hypothyroidism.
That's right. Next, we have exercise.
Exercise.
Regular physical activity can help boost metabolism, improve energy levels, and manage weight. All important factors in managing hypothyroidism.
Right.
Aim for at least 30 minutes of moderate intensity exercise most days of the week.
Got it. And then there's stress management.
Stress management. Yes, chronic stress can wreak havoc on the endocrine system, including the thyroid gland.
Right.
Finding healthy ways to manage stress, such as yoga, meditation, deep breathing exercises, or spending time in nature, can be beneficial.
And then, of course, there's sleep.
Sleep.
Adequate sleep is crucial for hormone balance and overall health.
Absolutely.
Aim for 79 hours of quality sleep per night.
This is all fantastic advice.
Yeah.
It really highlights how much control we have over our health when we make those conscious choices.
Right. And while hypothyroidism can be a challenging condition,
It can be.
it sounds like a combination of the right medical treatment
Yeah.
and supportive lifestyle changes can make a real difference.
Absolutely. By taking a proactive and holistic approach, people with hypothyroidism can absolutely live full and healthy lives.
That's great to hear. We've covered so much ground symptoms, diagnoses,
Yeah.
impact on other health conditions, the mental, emotional aspects, and even treatment options.
That's a lot.
But you mentioned there are some more nuanced and even controversial aspects of hypothyroidism that we haven't explored yet.
We haven't.
Yes, in our final part, we'll dive into some of those more complex and cutting-edge topics,
Okay.
like subclinical hypothyroidism and the future of research in this area.
I'm excited.
Me too. Stay tuned for part 3, everyone. Welcome back to the final part of our hypothyroidism deep dive.
I'm excited for this.
Me too.
These should be interesting.
You've sent us some really fascinating articles.
I tried to pick good ones.
You did. And I have to say, even I'm learning some new things.
Really?
Yeah.
Oh, that's great.
About this complex condition.
It is complex, yeah.
In this final part, we're going to explore some of those more like nuanced and even controversial.
Yeah, the gray areas.
Yeah.
The cutting edge.
Aspects of hypothyroidism that you were curious about.
It's fascinating stuff.
So what's first on the agenda for our deep dives into the deep end?
Let's talk about subclinical hypothyroidism.
Ah, yes. The gray area of hypothyroidism.
Gray area.
Can you remind us what that means exactly?
Absolutely.
Okay.
So subclinical hypothyroidism is when your TSH level,
right,
that's thyroid-stimulating hormone, is slightly elevated.
Okay.
But your T4 levels,
right,
the actual thyroid hormone, are still within the normal range.
So it's like your body's whispering that something might be off.
Yeah, that's a good way to put it.
But he hasn't, like, shouted it from the rooftops yet.
Not yet.
And the tricky part is that not everyone with subclinical hypothyroidism experiences noticeable symptoms.
Right. Some people feel fine.
Yeah.
And this is where the controversy comes in.
Right.
There's debate about whether and when to treat it.
Ah. So this is where that to treat or not to treat dilemma comes in.
It is a dilemma.
What are the arguments on both sides?
Well, some experts argue that treating subclinical hypothyroidism, even if symptoms are mild, can improve those subtle but annoying issues like fatigue, weight gain, and mood swings.
Yeah.
There's also some evidence suggesting that early treatment might help prevent long-term complications like cardiovascular disease.
So there's a potential preventative aspect to treatment.
There is.
Even if you're not feeling totally awful.
Exactly.
But on the other hand, some experts caution that treatment might be unnecessary.
They do.
Especially if those symptoms are barely noticeable.
Right.
Or if you're not experiencing any at all.
Yeah, if you feel fine, why take medication?
Right.
They're also concerned about the potential side effects of thyroid hormone medication.
Of course.
Any medication can have side effects.
True.
And it's important to weigh those risks against the potential benefits.
Yeah, it sounds like there's no easy answer here.
Nope.
It really is a balancing act.
It is.
Weighing those potential benefits
Yeah.
against the potential risks.
And that's why the decision to treat subclinical hypothyroidism is ultimately a personal one.
Right.
Made in consultation with your doctor.
Of course.
You need to consider your individual circumstances, your age, your overall health, the severity of your symptoms, and your own personal preferences.
Right.
And have an open and honest conversation with your doctor about the best course of action for you.
Okay, so subclinical hypothyroidism is definitely a nuanced area.
It is.
Where there's no one-size-fits-all answer.
Right.
What else is on our list of deep dive topics?
Let's talk about alternative and complementary therapies.
Yes. This is an area where I know there's a lot of information and misinformation floating around.
There is.
What are some of the things that people are trying, and what does the science say about them?
There are definitely a lot of options out there.
Right.
People are exploring dietary changes.
Okay.
Supplements like selenium and zinc, herbal remedies, acupuncture, and yoga.
Wow.
To name a few.
Are there any of those that have strong scientific support?
Some small studies suggest that certain supplements and lifestyle changes might be helpful.
Might.
Yeah, but we need more research to know for sure.
Right, of course.
And it's really important to remember that these therapies are meant to complement conventional medical treatment, not replace it entirely.
So it's all about working with your doctor.
It is.
To find that personalized approach.
Yeah.
That combines the best of both worlds.
Exactly.
Speaking of the future, what's on the horizon in terms of hypothyroidism treatment and research?
It's an exciting time.
I bet.
Researchers are working on developing more personalized treatment approaches.
Oh, wow.
That take into account your unique genetic and metabolic factors. Imagine getting a treatment plan. Tailored specifically to your body's needs.
Right.
That's the goal.
So moving away from the one-size-fits-all approach towards something much more precise and individualized.
Right.
I love that. What else is in the pipeline?
They're also exploring new drug delivery systems.
Okay.
Like sustained release formulations of thyroid hormone. These could potentially improve medication adherence and reduce the need for daily pills. Yeah.
Which could be a game changer for many people.
Wow, that would be incredible. Anything else is particularly exciting?
There's a growing interest in the role of the gut microbiome in thyroid health.
Oh, the gut microbiome.
Yes.
Researchers are exploring how those trillions of bacteria living in your gut might actually influence your thyroid function.
It's incredible.
It really is. So much is still being discovered.
So much.
Well, this has been an incredible deep dive into the world of hypothyroidism.
It really has.
We've covered so much ground from the basics to the cutting edge.
Yeah.
And I feel like we've both gained a much deeper understanding of this incredibly complex condition.
It's been an honor to be a part of this.
What are your final thoughts?
Hypothyroidism can be challenging, but knowledge is power.
Well said. And to our amazing listener, thank you for joining us on this incredible journey.
Yes, thank you.
We hope you found it informative, insightful, and maybe even a little bit empowering.
We hope you learned a lot.
And remember, you're not alone in this.
There's a whole community of people out there navigating hypothyroidism.
It's a huge community.
Don't be afraid to connect, share your experiences, and support each other.
That's right.
We encourage you to continue researching, asking questions, and being your own best advocate.
You got this.
Until next time, happy diving